I'm David Hepner, and I was invited to come from Boston, from the Brigham and Women's Hospital. I was very lucky to be invited to the 20th International OB Anesthesia meeting that Santa Joana has been doing for the last 20 years. They have been a leader in the field, bringing a lot of, I'm lucky that they consider myself an expert. For the last 20 years, they have been the best and the brightest. Whatever gets done, not just in the United States, but the United States, Canada, Europe, Australia, around the world, they like to bring it here so that all of their doctors, and not just anesthesiologists, today there was also a radiologist that was here. A lot of the doctors that work at Santa Joana, they could learn what's happening everywhere in the world. And that's good for the patient because the patient is going to be the one receiving the care. Whatever the providers, whatever the doctors learn, the patients are going to benefit. Also, there's a lot of use now in simulation, and one of the doctors, Monica Cialis, actually spent some time in Boston. She spent 4 weeks learning about simulation, and within a few months of having been to the course, she comes here, and I just went to a sepsis station, in which actually, that one I didn't give the conference, that one I was attending, and I actually learned tremendously. Like if I have a patient in sepsis, now I could manage her much better. The questions from the group, about 50% of the doctors in the sepsis scenario were from Santa Joana, and they had great questions, and they actually learned how to better manage a patient if she was going to get into some complications with infection. So overall, I think Santa Joana has a world-class type of treatments, facilities, and it's not just staying put, but it's trying to learn more, to bring people from the outside, to teach their doctors how to better provide care for the general patients, for the standard patients, and also if the patient were to have any complications.